Hi, and welcome to Introduction to Epidemiology. I'll be your professor this quarter. My name is Brenda Shivaramakrishnan, and today we'll be talking about Chapter 1 of your textbook, Epidemiology Matters, which is in methodological foundation to epidemiology. So if you're unfamiliar with the term, epidemiology is the science of understanding the causes and distribution of population health so that we may intervene to prevent disease and promote health. Examples of questions that epidemiologists might ask are, what is the incidence of myocardial infarctions between 2010 through 2020 among women born in 1950 in the United States? Other questions are, what are the causes of myocardial infarctions in this population? And if we were to change population dietary habits, what improvement in myocardial infarction incidence could we affect? And when I say incidence, I mean occurrence of new cases, and we'll cover the terms more going forward in this course. So in this chapter, you'll be reading about the evolution of epidemiology in the Western canon of epidemiology, our approach to teaching, 7 steps to conduct an epidemiologic study, Farlandia, which is a fictional place sort of used in your textbook for examples and developing concepts, and the summary. So we'll start with evolution of epidemiology. Epidemiology is relatively new as a formal scientific discipline, but it's been practiced for centuries, especially in eastern parts of the world, Asia and Africa, the Middle East, where science has been going back to, or at least medical science has been very old and recorded in history, and they've been counting diseases and keeping track and doing surveillance for a long time, but it doesn't quite match with our allopathic science, so we'll table that conversation for later, hopefully this quarter or definitely in fall. So as far as epidemiology that we are practicing today, many of the design and analytic techniques that we use arose in response to health concerns during the 19th and 20th century. Some of the big founders of epidemiology from Europe and the Western world are John Grant, who in the 17th century pioneered approaches to tabulating population health and mortality and rates, ratios, and proportions. William Farr, who is the namesake of Farlandia, in the 18th and 19th century developed more sophisticated life tables approaches to understanding the force and burden of mortality. And if you remember demography and our demographic table, life tables are used extensively in the field of demography, which is really about population dynamics and change. John Snow was a physician in London, and in the 19th century, he's most famous for the Broad Street pump case of where there was a cholera epidemic, and we'll include a media clip in your Module 1 reading some media more about this, but basically how he developed and applied basic measures of disease frequency and occurrence during his career and used very interesting techniques that were novel at the time, such as mapping and frequencies and things like that. So the history, just a few more things. So in the 19th century, it was focused on infectious disease, and in the 20th century, epidemiology became more focused on non-communicable disease as well. If you remember our friend from University of Edinburgh, you might remember from from fall quarter that we studied the epidemiological transition, and that there were three major phases: pestilence and famine, which were characterized by mostly infectious disease, wars, and famine; receding pandemics, which were nutrition-related, sanitation, medical care; and degenerative diseases, which is sort of the problems of today and the last about 100 years in the Western world. And we also remember that in other more low-income and middle-income countries, some of these phases are overlapping. So to keep that in mind. And just to finish up this history, the methods were really formalized in the 1970s and 1980s by people who have written some of the major textbooks and works of today, which are Rothman, Meitinen, and Greenland. So current conceptual movements that are important to know in Chapter 1. The eco-social perspective on population health suggests policies, institutions, and characteristics of context contribute to the shaping of health. And we know this when we studied the social conditions as fundamental causes of disease. So that context or surrounding is a major player in disease and population health. Also, the life course perspective, which we touched on briefly in fall, which includes determinants of health that are distributed across the life course and before conception. So we saw that in the Amuna and Zotor article, where exposures during gestation of babies, of fetus, resulted in chronic disease later. So therefore, epidemiology understands causes of population health across levels, from cells to society, and across the life course. So just to quickly review the eco-social framework, we saw it in your Nancy Niles textbook in the fall very briefly, and just to elaborate on, now that you know more about laws and policy in community health from your winter quarter class, we know that social and economic policy plays a great role in community health, as we saw in the film Sicko in fall quarter, that these policies are really influential and they can make or break the health of an individual, of a family, and of a whole community. Institutions, what this is referring to is schools, prisons, hospitals. So these are establishments that also are large players in the society, but also in the health of a community. Neighborhoods and communities, often health is measured in using a neighborhood or a community as a unit, because very often exposures are at the level of a neighborhood or a community. Living conditions generally refers to the unit of family, and so this is exposures that happen in a household, maybe mold or lead paint is happening in a household, though it may happen in many households in a neighborhood, or if it's violence happening in a household, it may also be happening on a neighborhood level. Social relationships are interesting. It's an individual construct in the sense that an individual with more social network and social, as we saw in fall quarter, that resilience has to do very much with social relationships. So this is both for an individual, but also for that network of people comprising the social relationships, or kinship when we're talking about family. is important and very diverse in terms of when it comes down to culture or geographic place or things like that. They may differ substantially in social network. Individual risk factors, we all know our own risk factors that we have in our life, our diet, our own exercise routines, our medicines that we take, and then it also comes down to some of the genetic and constitutional factors. What were we born with? And we're starting to see that the pathophysiologic pathways that we often, for very long in allopathic medical science, that we thought were fixed ideas, but really the disease process is so unique for each person, and we no longer attribute much of the diseases that we get to genetic and constitutional factors, and they're more often, as we're seeing now, due to other exposures. And so this individual population health is very much to do with this genetic and environmental, so the gene-environment interaction, which is also addressed here, and the life course, so exposures in utero, and how those affect us through the entire life. So just to give you a better quick look at the life course approach in detail, say we take the disease cancer, fetal life, it might have been connected with mother's nutrition, exposure to carcinogens during gestation, fetal growth, and birth weight. We looked at birth weight quite a bit in the fall. Infancy and childhood, so breastfeeding increases immunity, as we've seen in some of our readings or that we may look at later. Behaviors, physical activity, food choice, obesity, and adolescence, smoking, contaminants in our food, our air, our water, which is another thread here, the importance of environmental exposures throughout the life course. Again, physical activity, inactivity, and adult life includes pregnancy and lactation, but also our own, as I said in the previous slide, our own risky behaviors or our own choices or our own limitation of choices, the diet, tobacco, alcohol, exercise again, and then the older age, and you see how this accumulated risk kind of increases with age. It starts here, but the genetic susceptibility also increases due to that gene-environmental interaction. So briefly, I'll just talk about our approaches to teaching epidemiology. And when I say our, I mean myself, but I also mean Galea and Kais, who Dr. Galea was my professor, and they are influential in my thinking because they speak about something unique, which is an epidemiology of consequence. And what does that mean? It's really about how taking all this data of vulnerable populations, surveillance programs, information that's really sensitive, and what we choose to do with it, and how we work with this data, the ethics, and the best, most considered way to practice epidemiology. So I think that's very unique in this book, is an epidemiology of consequence. So in this quarter, we'll be focusing on underlying concepts of methodology, and we'll also later be getting into terminology and the science beyond underlying concepts. So in the next part of this lecture, we'll cover the 7 steps to conduct an epidemiologic study. We'll talk about Farlandia, the fictional land for our developing theories and concepts, and just summary of the chapter. So I hope you have a enjoyable time reading this book and enjoy chapter 1, and I'll see you next time.